It has been 1 week since we learned of a positive case of COVID-19 in our community. Although the numbers have risen since that first announcement, we acknowledge a time frame for virus incubation. Since that time, we have come together as a community to respond by helping impacted families and putting into place precautionary measures to prevent the spread of the virus within our community. Leadership commends the work and care behind our pandemic response and those who make sure that our essential and critical services continue. We thank our community wellness teams for mobilizing quickly to contain the spread of COVID-19 in our community and to provide support to impacted families, helping them with their isolation needs and supporting their spiritual, emotional, and mental health needs. We thank the support of community partners like Indigenous Services Canada, who have been supporting our work in contact tracing and monitoring people during self-isolation. Not to mention their help, advice, and guidance in responding here at home. We also thank our people, our community residents, our families. We thank you for helping our community response by doing all that you can to be safe. The virus travels through people. By staying home and practicing public health guidelines, we are doing our part to contain COVID-19 and block opportunities for it to spread between our families. For the time being, we ask that you continue to do what you can to help keep us all safe as we move towards recovering from this outbreak situation. We strongly ask that you continue to refrain from visiting each other between households, even if you are vaccinated, and especially if you're in self-isolation. We ask that you keep wearing a mask, washing your hands, and maintaining distance, and remain aware of your own physical health. Our safety as a community remains a matter of personal responsibility by everyone. We all need to work together and cooperate with those conducting contact tracing work or helping to support impacted families. We ask for your patience and cooperation with our response teams. Our team is managing the current situation, and we will not hesitate to reach out for assistance and support from others as needed. Our pandemic response teams, our EOCG, leadership, and Sagamok organization responded quickly, deliberately, and with care. We should all be aware that with the nature of this virus, we don't see the outcomes of things we do today for up to 10 days down the road. This means that it will take 10 days to see if our measures have been successful, if what we have been doing has been enough to stop the spread of COVID-19 in our community and move us well into recovery and back to where we have 0 cases. It is too early to tell right now if what we were doing is effective. As always, the best thing we can do as families is to be prepared. Families are encouraged to make sure that they know what to do if anyone in their home needs to go into self-isolation. Everyone should be familiar with their family's plans to provide a safe space for isolation and support those family members in needing to do so. Yes, these are days of high stress and high anxiety for our community. Again, it is not a time to panic, nor to blame or shame. It is a time to be diligent, practicing what we all know to keep us all safe. We have the tools to respond. We have the resources to do so. We will also receive an update from our community health team as part of this update. As we move ahead with our response to the current situation, as long as we work together in unity, we will get through this. Miigwech, Gazagin Tinawaya.
Good evening, everyone. My name is Melanie Lazarus. I'm the Community Wellness Director in Sagamok, as well as the Incident Command with the Emergency Operations Control Group. I'm here to give you guys an update about the response to COVID-19 being in the community. So as of today, November 25th, there have been a total of 13 confirmed positive cases of COVID-19 associated with the community. We have received confirmation of our first positive case on November 18th, and we have been reporting our community case numbers daily. At this time, all 13 confirmed positive cases remain active, with none having been resolved. We report our daily case numbers as total confirmed cases to date, along with resolved cases and active cases. We know that there have been suggestions from community members requesting the number to post the number of households associated with our case reports for the community. We have not been able to do this due to privacy matters and privacy concerns, as we do not want to stigmatize those individuals that have been affected by COVID 19. So we do hope that community members can understand and respect the privacy of the individuals that are affected. Community members are reminded that it is our own actions that will determine how long we continue to experience active cases of COVID 19 in Sagamok. So, isolating yourself, if there is a possibility you might be ill, is crucial. Not only are you protecting your close family members and loved ones, but also protecting those who may experience dangerous symptoms of COVID 19. If you have any COVID 19 symptoms, please arrange to get tested and stay away from others until you are advised of the results. I also wanted to let you know that time plays a big factor in our community response. We can't see the immediate results of our actions for at least 10 days down the road. This is the time it can take for someone who contracts COVID-19 to start exhibiting symptoms of the virus. I also wanted to remind you all that since November 18th, the Sagamok community is under a stay-at-home recommendation. We ask that you continue to stay home and not visit each other between households, even if you are vaccinated, and especially if you are in self-isolation. We ask that you keep wearing your mask, washing your hands, and remaining aware of your own personal physical health. You are asked to arrange to get tested if you do experience any symptoms of COVID-19. For the time being, the following precautions do remain in place in the community. So I will just go through them. The first one is services delivered by the Sagamok Anishnawbek organization. They're now limited to critical and essential services. Group gatherings have been suspended, and where possible, programming, activities, and events have moved to online platforms. The Elders Eagle Lodge is closed to visitors. The Multi-Educational Center is closed to the public, except for the food bank. Sagamok bingo operations have been suspended. The daycare is closed. The Dobbin students have moved to online learning. The Adult Learning Center is closed with students working from home. All school transportation services have been suspended. Espanola High School remains open for learning if parents choose to transport their students to the school. I believe students may also have the option to move to online learning. We are recommending medical grade face masks when entering all community buildings. Cloth masks and masks made of other material, they're no longer permitted for use. Residents are strongly encouraged to stay at home as much as possible to help contain the potential spread of the virus in our community, as well as incoming traffic is closed to visitors. Families, we are reminding you to look out for other members of your families as well as extended families at this time. And this might mean checking in with elders and other vulnerable members over the phone to see how they're doing and if they need anything. It may also require you to check in with those we know who are struggling with mental health issues and family stresses to see if they need to talk or some other supports. Check in with family members by phone who may be isolating as well to see if they need supplies or words of support. I also wanted to note that our mental health and addiction services, they continue to operate with our staff available through email and phone. Our community after hours comfort line, it also remains ready to help, and that number is 705-863-3178. There are also several crisis lines available to call if you need to reach out, and just do not hesitate to ask for that help. And if you need to access those phone numbers, you can call the health center. Families, you're asked to prepare yourselves as well as your families should you need to isolate. Um, be familiar with your own preparedness plans, knowing what to do if the need arises for them. And if you need support with doing that, please reach out to the health center and we can certainly provide that support to you. Residents, you are all reminded that all official pandemic response communications materials are hosted on the Sagamok Anishnawbek COVID-19 Alert Facebook group. This, along with our website at www.sagamok.ca, are your primary channels to access all our pandemic response notices and resources. So I do want to thank you all for listening, and please stay safe and follow our recommendations, and we will be seeing you again next week. Have a good evening.
Now let's talk about what it means to self-isolate. We know that the virus can spread through when we contact with people, and it's necessary for those who have symptoms or who have COVID-19 to self-isolate. That means you're preventing the spread of COVID-19. So if you have symptoms, if you've been contacted by a member of our team and informed that you may have been exposed to COVID-19, or if you live with someone who has been exposed to COVID-19 and has been tested for COVID-19, you must self-isolate. If you self-isolate, to do this, it means you stay at home, don't go to work or school or other public places. When it is safe to leave, you will be informed when your isolation period is over. But you must only leave your house to see a healthcare provider if necessary, and make sure you stay 2 meters away from others and wear your mask. Make sure you wash your hands. If you sneeze or cough, cover your sneeze or cough, and limit, if you must have visitors to your home, to the time that they are there, and ensure that you're wearing your mask and they are as well. And make sure that you have at least 6 feet distance between each other, and avoid contact with everybody as much as possible. I hope this helps to answer some of the questions, and we strongly encourage you to listen to the public health advice. If you have further questions, you may go on Public Health Sudbury District's website. They have a lot of very good information that can help answer any further questions. Thank you, Miigwech. And just to remind everybody, what are the symptoms of COVID-19? Of course, everyone knows that if you have fever or chills, if you have a cough or barking cough like croup, that's unusual for yourself. If you have shortness of breath, that's unusual for yourself. If you have a decrease or loss of sense of smell or taste. If you have muscle aches or joint pain, that's unusual. And also extreme tiredness. We all know that those are now considered the symptoms for COVID-19. If you have those, please isolate and get tested. You can get tested by booking through the COVID Assessment Center through Espanola, and that is from Monday to Friday from the hours of 8 until 4. I'd like to take some time to answer some questions that we have heard through the online community about what is going on here in Sagamok with COVID-19. The first is about contact tracing. What is it? What does it involve? And why are we engaged in doing it here in Sagamok in response to the confirmed positive cases we have? So contact tracing helps to stop the spread of COVID-19, and is the process of attempting to identify people who have recently been in contact with someone diagnosed with an infectious disease so that they may be treated or isolated to prevent the spread of disease. When someone receives a positive test for COVID-19, they are known as a case. A nurse will contact the case and ask them to identify any contacts of people who they have spent time with. Now, not everybody needs to be identified. Only those who have been exposed to the case's respiratory droplets from coughing, sneezing, or speaking in close contact are to be identified. Those who have received a positive test for COVID may tell others that they have COVID but they cannot do their own contact tracing. That must be left to this team. Those who receive a call from public health or from the community wellness department will also identify contacts to inform them that they have come into close contact with a positive case of COVID-19 and ask them about their symptoms. Those who report symptoms will be asked to book a test. Contacts with no symptoms are asked to self-isolate for 10 days since their last contact of a positive case, to monitor themselves for symptoms throughout that time, and to get tested, usually on about day 7. Now, if the contact tests positive for COVID-19, the whole process must start again to identify their contacts. If you do receive a call from our team informing you that you have been exposed to someone with COVID-19, you need to immediately self-isolate from other people for 10 days. This means that you cannot leave your home unless you are to get tested or you have an emergency. If you live in a same household with a positive case, you will also be advised when to get tested. At any point in time, if you have any symptoms for COVID-19, please self-isolate and book a test. Ane, good evening, everyone. My name is Shelley, and I'm the clinical nurse manager here at the Community Wellness Department, and I help to support the Director of Community Wellness and also the emergency team here.